Hi, my name is Neica Lafleur. I'm with the Upptik and Media team, and today I have.
My name is Annel. I'm a nurse practitioner. I went to Sacred Heart to get my BSN, and I also went to Sacred Heart to get my MSN.
So, what made you want to pursue an MSN after you had already obtained your BSN?
So, as a nurse, you only have a certain amount of autonomy. So, you can give medications, you can take care of patients, but you don't have the right to order anything or prescribe or actually lead. So, there were a lot of things that I saw in the healthcare field that I wanted to change, but I didn't have the autonomy to do so. So, I wanted to be a nurse practitioner in order to be able to kind of do the changes that I saw that were wrong in the healthcare field.
That's good. So, it basically helped you get more autonomy in the healthcare space. Is that right? Okay.
Mhm.
Did you always know that you wanted to work in healthcare?
Yes.
Okay. So, like, it was it like something that you saw as a child, like a family member worked in healthcare, or was it something that was shown to you through your high school years, or maybe, the first couple years of your college experience?
So when I was a kid, both my mom and dad had health issues, so that kind of inspired me to be in the healthcare field. And then my aunt, she is a nurse too, so she also talked to me more about nursing and what it entailed, so that grew my interest as well.
That's wonderful. So you really did live up to your desired dreams when you were much younger.
hmm
So walk us through what a day in your role looks like.
As a nurse practitioner.
Yes.
So, as a nurse practitioner, I work at a weight loss center currently. So, what I do, I start my day by looking at my patients' charts, seeing if they have any major health history, if they're on any medications, because that could counter interact with anything I'm going to prescribe or give. And then I go see my patients. They're typically like 15 to maybe an hour, especially if they're like a new patient. It could take an hour visit because I have to go over their labs and do EKGs. And I kind of assess them, see what care I can give them based on their life and their day to day. Because with nursing, you'll see like everything is very individualized based on the patient. Like not every person you're going to treat the same. So I kind of have to take it patient by patient. And then at the end of the day, I'm just finalizing any charting I have to do.
That's great. What would you say is the most challenging part about addressing those health issues with your patients?
Like I said, everyone is very different. So two people can have high blood pressure, but that doesn't mean you're going to treat them the same. One medication may not work for one person, or one plan to lose weight may not work for the other person. Or another person could have a very simple lifestyle, has time to exercise and eat healthy and go grocery shopping, while the other person works a 12-hour shift and they don't have the time to do so. So it's tailoring everything based on that person's lifestyle.
That's good to know. So, from your perspective, you also touch a little bit on the nutritional aspect of weight loss, right? Could you tell us a little bit about that?
So, from my experience, I realize a lot of people don't have that much knowledge when it comes to nutrition. And that's the thing that made me want to be a nurse practitioner because a lot of times we just focus on the medical, like when it comes to healthcare, I feel like they focus more on medications. And if you have high blood pressure, diabetes, it's like, all right, let's prescribe you a med. And we're not really informed on how to do those things just with lifestyle changes, which is eating healthy and making sure that we're exercising. So I'm able to help people before they get to the part where they have to take medications for their obesity.
That's wonderful. So, you operate from a stance of prevention and maintaining a lifestyle rather than a quick fix.
Yes.
That's beautiful. Um, what skills would you say has been the most important skill that you basically use on a day-to-day basis?
Time management. I think anything in
Very good
healthcare.
one.
Oh, yeah, anything in healthcare really is time management because if you're not organized with your time, an easy day can become a hard day. So being there on time, making sure that you're looking ahead to see what each patient entails is super important.
That's wonderful. So I'm just gonna track back a little bit. As far as schooling, how hard was it for you to transition from BSN to MSL? What to MSN? What were the courses like?
It was so the easy there was easy parts and there were hard parts. So the easy part was, as a nurse you already have the foundation. So when it comes to like the actual health courses, like learning about medications, learning about different diseases, that wasn't hard because I used to see that on a day-to-day basis as a nurse. However, as a nurse practitioner, now you're learning how to prescribe and how to lead and delegate to other people, because now you're the one in charge. So it's a little different, and going from just taking orders basically to now you're the one delegating, I feel like that was the hard part.
So another question is what keeps you motivated when you're having a hard day and you find that you're not having the support that you need to get the job done?
I think the patients kind of help me out, because as there are going to be hard patients, there's going to be like a hard work environment. I feel like no work environment is 100% perfect,
Right.
but having patients that are so grateful for what you do for them, I feel like that's motivating enough. Because I do have a lot of patients that are like, oh my God, like you've helped me so much. I've lost so much weight since you started here. That's enough for me to be like, all right, like I am doing something.
That's good. Well, I'm happy that you're making a difference in your community. That's wonderful to hear. What would you say are some of the misconceptions that people may have about either the nursing field or being a nurse practitioner?
I don't think people realize the impact that we have on others. Like people talk about it all the time, how yeah, like nurses, and we see it on TV and we see it on the news, but it's we really are the heart of the healthcare community, because we're the ones almost always touching the patients, hearing their stories. Like patients really tell us everything about their lives, and we're the ones impacting. Not I don't impact just like their weight loss. I'm listening to what's going on in their life. Like maybe they had a family death. That's why it's hard for them to lose weight. Now I'm helping them now in their mental health issues. Like why don't we go see a therapist and let's worry about your grief. Like there's so many components to it, and it's not just that one healthcare aspect that we're helping them with.
So, in other words, you're wearing multiple hats and having to make referrals to different fields in places where you yourself can't intervene, but you have the right information to help them um, get the help that they need.
Correct.
So, what would you say to any high schoolers right now that may be interested in healthcare or maybe becoming an RN or physical therapist, RTs, etc.? What advice would you give them towards going to college and how to make like a choice into which one they'd like to major in?
In regards to healthcare field, you have to like it. There's no other way around it. If you don't like it, it's not the field for you. And if you like it, you'll be successful and you'll be great at it. But healthcare in general, it's you're dealing with people. People can be very difficult. There's no like cute part about it. So if you don't like helping others, if you're not compassionate, if you're not understanding, it's not gonna be the route for you. However, if you are the type of person that does want to make a change and help people, then the classes you're gonna be able to do that. You're gonna be able to pass your classes. You're gonna be successful in your career. You're gonna be able to escalate and go into those leadership roles, because you already have the heart in it. You just have to do the educational part.
You know, that makes a lot of sense. Having your heart into what it is, whatever it is you choose to major in, make it your passion so that it's a lot easier when you have those hard days. You're not
Hmm.
leaning towards, oh, I want to quit versus,
Yeah.
oh, let's find a balance and make this job something that I enjoy doing on a daily basis.
Hmm.
Thank you for coming. Thank you for taking the time and doing this interview with us. We appreciate it.
No problem.